A class action lawsuit filed against Arizona for the massive Medicaid scandal, the sober living crisis that cost the state billions of dollars.
Fox 10 investigator Justin Lum has more on this class action lawsuit tonight. Justin.
And we have been combing through the 125-page class action complaint, and we spoke to the lawyers today who filed it. They say Arizona's Medicaid system access and the Department of Health caused thousands of Native Americans to suffer through injuries, deaths, drug addiction, and homelessness due to the so-called sober living crisis, ultimately blaming the state for allowing this all to happen.
I mean, they were treated like chattel, more or less. I mean, they weren't treated as human beings.
Nearly $3 billion ripped from the state's Medicaid system. Lawyers John Brewer, Dane Wood, and Brooke Lasky say Arizona knew massive fraud was happening back in the summer of 2019.
If you know the problem exists, why aren't you taking care of it?
Fraudulent billing for behavioral health services grew from $43 million to $2.8 billion, according to the newly filed complaint. By 2023, transforming into a humanitarian crisis after the state cracked down on facilities across Arizona believed to be involved in the scheme, preying on Native American Medicaid members, not just in the Valley, but New Mexico.
Many of the fraudsters drove across state lines, went to cities like Gallup and Farmington, took people from there, brought them here to Phoenix, and then took advantage of the benefits available through access.
The complaint lists several representing plaintiffs, some deceased, some now incapacitated, and some children.
But it's just the systemic failures within access, just to see. We've heard of so many deaths that really, as far as one standing out that is more tragic than another, really is hard to say because they're all tragic.
Lawyers say the state had egg on its face and used indictments and arrests to go after bad actors, while vulnerable Native Americans developed more addictions, were displaced, or died. Documents say Dr. Satya Sarma, a former medical director for Access, warned supervisors in 2020 as employees raised concerns about providers who opened new facilities under different names if they faced trouble. During one meeting, Dr. Sarma was allegedly told to stay in her lane.
Why weren't resources devoted to making internal changes at Access and solving this problem rather than letting it grow to these, as Brooke called, epic proportions?
Reva Stewart, an advocate for stolen people, stolen benefits, says outreach to displaced relatives is far from over.
So we average about 100 to 200 people per week that we're helping out.
Plaintiffs are suing the state for gross negligence and wrongful death, asking for damages exceeding $300,000.
We reached out to both Access and the Department of Health for comment. Both agencies cannot comment on pending litigation, but sent us this joint statement that reads in part, addressing behavioral health fraud remains at the forefront of our efforts. Governor Hobbs and state agencies have acknowledged the pain and suffering associated with behavioral health fraud and the significant impact on tribal nations in Arizona. The Hobbs administration has taken swift action against the fraudulent providers, prioritized an emergency humanitarian response, and continues to prioritize operational reform in collaboration with law enforcement and tribal partners. Now, for all of our coverage on this Medicaid fraud scandal and the sober living crisis, just head to fox10phoenix.com/soberliving. I'm Fox 10 investigator Justin Lum.